What you're looking at right now is what 12 years of untreated tartar actually looks like on real human teeth. And I know what you're thinking. How does it even get that bad? And more importantly, can it ever come off? Stick with me for the next 10 minutes because today we're going deep inside the science of tartar. Where it comes from, why it gets rock solid, what it does to your body beyond just bad breath, and the real evidence-based ways to deal with it. Whether you're watching this for yourself or someone you love, this information could genuinely change the health of your teeth for the rest of your life. Let's get into it. Section 1. What is tartar? Alright, before we talk about cleaning it, let's understand what we're actually dealing with. Because tartar isn't just dirty teeth, it's something much serious. Here's how it starts. Your mouth is home to over 700 different species of bacteria. Now, most of them are harmless, but some of them feed off the sugars and starches you eat, and when they do, they produce a sticky, colorless film called plaque. You've probably felt plaque before, that fuzzy feeling on your teeth in the morning before you brush? That's it. Now, plaque is actually removable. A good brushing and flossing routine removes it every single day. But, and here's where it gets serious, if you don't remove plaque within 24 to 72 hours, it begins to mineralize. The calcium and phosphate in your saliva, minerals your body uses to strengthen teeth, they start to bind with the plaque, and the plaque hardens. It calcifies. It turns into what dentists call calculus, or what we know as tartar. And once tartar forms, you cannot brush it off. You cannot floss it away. It is literally bonded to your tooth surface like cement. Now imagine that happening for 12 years, layer after layer, year after year. The tartar builds up so thick that it covers not just the teeth, but the gum line. It goes under the gums. It creates a perfect hiding spot for more bacteria to breed. And that is when things get truly dangerous. Section 2. What 12 years of tartar does to your body. I want to be honest with you here, because a lot of people think tartar is just a cosmetic problem. Like, it looks gross, your breath smells bad, whatever. But the research tells a completely different story. According to the American Academy of Periodontalism, untreated tartar buildup is the leading cause of periodontal disease, which is gum disease. And gum disease affects nearly 47% of American adults over the age of 30. That's almost half of us. Here's what happens in stages. Stage 1, gingivitis. The bacteria trapped under tartar releases toxins that irritate your gums. They become red, swollen, and they bleed when you brush. This is your body raising the alarm. Stage 2, periodontitis. If gingivitis is ignored, the infection deepens. The gums begin to pull away from the teeth, forming pockets. Bacteria colonizes those pockets. Your immune system is now fighting a constant internal battle in your mouth. Stage 3, advanced periodontitis. This is where bone loss begins. The bacteria starts attacking the actual jawbone that holds your teeth in place. Teeth become loose. In severe cases, they fall out. But here's the part that most people don't know about. The damage isn't just in your mouth. A 2023 study published in the Journal of Periodontalism found strong links between chronic periodontitis and cardiovascular disease. Why? Because the bacteria from infected gums enter the bloodstream. They travel to the heart. They trigger inflammatory responses that increase the risk of heart attack and stroke. Other research has linked advanced gum disease to type 2 diabetes complications, cognitive decline, and preterm birth in pregnant women. This is not just about teeth, this is about your whole body. And it all starts with that plaque you didn't brush away. So, what do you actually do? Section 3. Can you remove tartar at home? Okay, I know you came here hoping I'd tell you there's some miracle home remedy, some baking soda plus lemon juice combo that melts away 12 years of tartar overnight. I've seen those videos. They have millions of views. And I have to be straight with you, most of what you see in those videos is either exaggerated, ineffective, or in some cases, actively harmful to your enamel. Let me explain what's real and what's not. What actually works at home? Number 1, Tartar Control Toothpaste. These aren't just marketing. They contain compounds like pyrophosphates and zinc citrate that interfere with the mineralization process, meaning they help slow down the formation of new tartar. They won't remove existing tartar, but they genuinely prevent more from building up. Number 2, electric toothbrushes. Studies from Cochrane reviews, which are considered the gold standard in medical evidence, show that oscillating rotating electric brushes remove 21% more plaque than manual brushing after 3 months. Less plaque means less tartar over time. Number 3, water flossers. The water pick and similar devices use pressurized water to flush bacteria from below the gum line. They don't replace flossing, but combined with regular flossing, they significantly reduce subgingival bacteria buildup. Number 4, oil pulling. Now this one's interesting. Oil pulling, swishing coconut or sesame oil for 10 to 20 minutes, has been studied in multiple clinical trials. A 2016 study in the Journal of Clinical and Diagnostic Research found it reduced Streptococcus mutans, one of the main bacteria in plaque, and reduced gingivitis markers over 30 days. It won't remove hardened tartar, but it's genuinely useful adjunct practice. What does not work? Lemon juice on teeth. The acid temporarily makes your teeth feel cleaner, but it's eroding your enamel, and enamel doesn't grow back, ever. Scraping tartar with bobby pins on metal tools at home. Please don't do this. You can damage your enamel, lacerate your gums, introduce bacteria deeper into gum pockets, and in rare cases, crack a tooth. The tools dentists use are precision instruments. They're not something you should DIY. Section 4, professional cleaning. What actually happens? If you have significant tartar buildup, especially if it's been years, the only real solution is professional dental cleaning. And I know some people avoid the dentist because of cost, anxiety, or just not knowing what to expect. So let me walk you through exactly what happens. There are 2 main types of professional cleaning depending on how severe the buildup is. Type 1, prophylaxis, regular cleaning. This is what most people get at a routine dental checkup. A dental hygienist uses ultrasonic scalers which vibrate at 25,000 to 50,000 cycles per second to break up and dislodge calcified tartar deposits from above the gum line. The water irrigation from the scaler flushes the debris away, then hand scalers are used to catch any remaining deposits. Finally, the teeth are polished with a special gritty paste called prophylaxis paste, which removes surface stains and smooths the tooth surface so plaque has a harder time adhering in the future. For someone who hasn't been to the dentist in a couple of years, this is usually sufficient. Type 2, scaling and root planing, deep cleaning. For severe cases, like someone with 12 years of buildup, regular cleaning isn't enough. The tartar has gone under the gum line, into those periodontal pockets we talked about. Scaling and root planing goes deeper. The hygienist numbs your gums with local anesthesia, then uses specialized instruments to clean deep below the gum line, removing tartar from the root surface of your teeth. The root planing part means they actually smooth out the root surface because rough surfaces attract more bacteria. A smooth root surface allows gum tissue to reattach properly and heals better. This procedure is typically done in quadrants, upper right, upper left, lower left, over multiple visits to allow healing between sessions. Is it uncomfortable? There can be sensitivity and soreness for a few days after, but it is genuinely life-changing for people with advanced buildup. Many patients report that after deep cleaning, their gums stop bleeding, sensitivity decreases, and their whole mouth feels healthier within weeks. The American Dental Association recommends professional cleaning every 6 months for most people. If you have a history of gum disease, they recommend every 3 to 4 months. Section 5. Prevention, the real game changer. Here's the truth about tartar, and honestly about most dental problems. Prevention is so much easier than treatment, so much less painful, so much less expensive. The gold standard prevention routine looks like this. Brush twice a day for 2 full minutes each time, not 30 seconds, 2 minutes. Use fluoride toothpaste. If you have a history of tartar, use tartar control formula. An electric toothbrush is genuinely worth the investment. Floss once daily, non-negotiable. Brushing only cleans about 60% of your tooth surface. The other 40% is between your teeth where plaque hides. That's where gum disease almost always starts. Use traditional floss picks, or a water flosser, whatever you'll actually do consistently. Use an antibacterial mouthwash. Chlorhexidine-based rinses are the most clinically effective. Studies show up to 87% reduction in plaque bacteria. For daily use, alcohol-free antiseptic rinses like Listerine Zero are a good option that won't dry out your oral tissues. Watch your diet. Bacteria love sugar and refined carbohydrates. The more frequently you eat these, especially between meals, the more fuel you're giving the plaque bacteria. Drink more water, especially after meals. Water helps wash food particles away and maintains healthy saliva flow. Saliva is actually one of your mouth's best natural defenses. And this one surprises people. Stop smoking. Smokers have dramatically higher rates of tartar buildup and gum disease. Smoking reduces blood flow to the gums, impairs healing, and creates a more hospitable environment for bacteria. This is one of the single biggest things you can do for your oral health. Conclusion. All right, we covered a lot today. From what tartar actually is to what 12 years of buildup can do to your heart. From home care myths to the real science of deep cleaning, and how to actually prevent this from ever being your story. If you found value in this video, and I really hope you did, please hit that like button. It genuinely helps this channel reach people who need this information. Next week, we're covering something that affects 1 in 4 adults, and most people have no idea they have it. We're talking about teeth grinding, or bruxism. What causes it, what it destroys, and how to stop it. You'll want to see that one. Take care of your teeth, take care of your health, and I'll see you in the next one.